Welcome to our tutorial on mastering multiple-choice medical coding questions using the elimination technique. In this video, we'll explore how to effectively approach these questions to increase your chances of selecting the correct answer. Here is the question. A 42-year-old female reports experiencing abdominal pain and non-menstrual bleeding. She previously had an abnormal pap smear which revealed a low-grade squamous interepithelial lesion. Today's intervention entailed a hysteroscopy with thermoablation of the endometrium and cryocotery of the cervix. These were executed without complications. What are the correct CPT procedure and ICD-10 CM codes for this service? Here are the answer choices. Letter A, 58555, 58353, and C54.9. Letter B, 58350, 57510, and C54.9. Letter C, 58565, 57511, and R87.612. And finally, letter D, 58563, 57511, and R87.612. At this point, you can pause the video to give you time to solve this question. Once you are ready with your answer, hit that play button to see the solution and the elimination technique employed to get to the solution fast. Ready with your answer? Let us see if you managed to eliminate your way to the correct one. In this scenario, we are presented with multiple procedure codes to account for the services provided to the patient. In these types of situations, we focus first on the first code of each of the letter choice. Furthermore, we remind ourselves that the first three characters of a CPT surgery code usually captures both the location of the operation and the type of service that was done. The first code of each of the answer choices presents us with either a 583 or a 585 code. These codes fall with the range of procedures performed on the corpus uteri. The initial difference amongst the choices has us comparing the codes at the third digit, where a 583 code would be an introduction procedure, while the 585 codes presented would be under laparoscopy or hysteroscopy. In the scenario, it is mentioned that the approach employed to perform the procedures is by scoping. Any procedure whose approach is other than that will not be appropriate to report. Hence, first to go is letter B, with its first code as 58350. The remaining answers all have primary procedure codes in the 585 series. This series captures services that are performed endoscopically, such as a hysteroscopy or laparoscopic. Throughout the entirety of the surgery section of the CPT, a general guideline regarding scoping procedures gets repeated many times over. And it is this: a surgical laparoscopy always includes a diagnostic laparoscopy. This guideline instructs us first to be aware that, in a series of codes where the approach is via scoping, there will be codes that are diagnostic in nature and then those, more numerous in number, which are surgical by nature. The diagnostic scoping codes usually sits at the top of the family of codes with the separate code tag found towards the end of its code description. And then underneath, the surgical scoping procedure codes follow. Among the remaining choices, letter A with 58555 reports a diagnostic hysteroscopy. The other two choices, C and D, have surgical hysteroscopies as their first code. A diagnostic hysteroscopy, like all diagnostic examinations, is performed to know or confirm the exact condition affecting the patient. As such, we do not expect to see definitive diagnoses already established before a diagnostic examination is performed. Diagnostic examinations, such as diagnostic hysteroscopies, also involve no more than a lookup of the patient's internal organs. We do not expect to see anything cut, removed, or repaired during a diagnostic hysteroscopy. The scenario presented to us fails on both counts. First, there already is an established diagnosis prior to the hysteroscopy. And when the hysteroscopy is performed, there was more than just a lookup or survey that happened. That being the case, we cannot report a diagnostic hysteroscopy and letter A is eliminated. Of the two remaining choices, 58565 captures hysteroscopy with bilateral fallopian tube cannulation. Nowhere can we find direct mention of such a procedure in the question. Hence, last to go is letter C. The correct answer is letter D, with 58563 reporting the hysteroscopy with thermoablation, along with codes 57511 and R87.612. By systematically evaluating each answer choice and eliminating those that do not align with the clinical scenario, we can increase our likelihood of selecting the correct codes in multiple-choice medical coding questions. We hope you are able to learn from this technique shared with you today. With much practice, this should become part of your strategy and bring you great results. Good luck on your upcoming medical coding exam.